Perfect. Thank you. All right. So thank you so much for that introduction, Leah. It has been such a good opportunity working with yourself and the rest of this group on the advisory board. So my name is Emily McKay. I'm a registered nurse, and I recently graduated from my Master's of Science from University of British Columbia. Clinically, as a nurse, I practice in early pregnancy and recurrent pregnancy loss. And then I also work as a knowledge mobilization coordinator at the University of British Columbia. My efforts there are more so focused on gynecologic cancers, working between the Gynecologic Cancer Initiative as well as the OVCARE Research Lab, which is an ovarian cancer research lab. Before I jump into things, I did just want to acknowledge that I'm coming to you from a little bit on the other side of the country today, and I'm located on the traditional, ancestral, and unceded territories of the Squamish and Tsleil-Waututh nations. I'm really grateful to be able to be living over here in British Columbia and exploring all the beauty that the lands have to offer. So why are nurses uniquely positioned to address barriers in abortion care? While this reason, consistency and availability may seem a little bit overly simplistic, I think it's important to recognize that nurses are one of the largest healthcare workforces, as well as one of the largest workforces in the country overall. So there's over 300,000 registered nurses and 6,000 nurse practitioners practicing across the country. So there are a ton of opportunities for nurses to actually equip patients with information and engage in counseling and really help to continue to destigmatize abortion care. Nurses also range in terms of the setting that they practice. Nurses are in clinics, schools, hospitals, acute care facilities, public health, telehealth. The list really goes on quite extensively. But despite legalization of abortion since 1988 in Canada, there are still significant barriers to being able to access abortion. And geographical access is the number one barrier that people can encounter. And so when we're looking at that, it's also important to ask ourselves which providers are those patients in geographically isolated areas most likely to encounter or to see. And nurses are quite often the answer to that. Nurses are quite often the person who's employed at a center where, maybe a provider is kind of coming and going or rotating between spots, but nurses are very likely to actually be present. And therefore, it's really essential that nurses are equipped with the right information about abortion care. Nurses are also available for most counseling interactions with patients, as well as often the witness to patients or the person who navigates through the healthcare system with a patient. Secondly, I would like to speak to the nurse-patient relationship. So there is quite a bit of public trust in nursing, and that is for good reason. Nurses are uniquely positioned to build relationships with patients and have really positively influenced the lives of so many patients. And I think that that's a big reason why the public is so trusting in the profession of nursing. But there's also the skill and the art of relational inquiry in nursing. So nurses are trained professionals in sensitive and open therapeutic communication and relationship building. Dewan and Barco define relational inquiry as the combination of relational orientation, a sound knowledge base, critical thinking and inquiry skills, strong clinical skills and clinical judgment, and ways of being. So when you break that down and think about it, it's taking a really strong clinical knowledge base, which often kind of already understands what's going on with an abortion when you think about it, and combine that with the clinical judgment and the ways of being to be able to engage in open and honest conversations. And you really produce such a unique opportunity for a nurse to engage with a patient and have an open dialogue. If we take, for example, a patient's in an emergency room and it's for a completely separate issue, and they turn to their nurse after this relationship has been established and start asking questions about, what options are available to me if I were to pursue an abortion? What would that look like? What would that feel like? And that nurse looks to the patient and can't answer any of those questions. they're not able to, even provide a referral to where they would be able to access those services in the community, that's going to have a very damaging effect on that relationship and most likely perpetuate the stigma that, this patient is doing something wrong or that there's something bad about the fact that they've been seeking out this abortion care. And so it is really fundamentally important that nurses have that information so that we're regarding abortion care as healthcare as opposed to an ethical issue. And so thinking about why that is so important. The next reason I would like to point to is nursing education. So when we talk about nursing curriculums being overloaded, absolutely, there is so much content that needs to be prioritized. However, a lot of the competencies that we think about when we think about abortion care are things that are actually already being taught in curriculum from a larger principle kind of perspective. So those include things like trauma-informed approach, cultural humility and awareness, gender-based violence, an understanding of health equity or social determinants of health, the principles of therapeutic communication. From a clinical perspective, you have surgical competencies being developed. Those who are trained in labor and delivery or childbirth environments are often taught about normal blood loss and how to keep a patient hemodynamically stable. These are all things that can be applicable to the nursing curriculum when talking about abortion care. There's also sexual health and reproductive counseling, as well as interprofessional collaboration. Lastly, the reason that I would like to draw upon is the underutilization of nursing leadership in abortion care. There is so much space here for nurses to continue to take that role in being advocates for accessible and inclusive abortion care and be given positions by the healthcare system that will allow them to have the scope and the time to practice in this area. These positions are often undersupported or not available across organizations with lots of money going more so towards things like childbirth or things like that. But nurses have a really great opportunity to be able to take up these positions and advocate in a way that is more formal than what's already being done. Nurses also operate on a salary basis versus a per patient billing system, allowing them more time to spend with each individual patient, and are often the face the patient is seeing throughout the procedure, providing them a really unique insight in what the patient experience looks like when navigating abortion care. Here are some references. Thank you so much.